designed a health and wellness initiative that we have launched under the Lincoln Park umbrella. And it's our Artists and Creative Health and Wellness Initiative in partnership with Newark Arts. And this whole focus is about some of the challenges that artists face. And we hear this thing all the time about starving artists, and people joke about that. That's real. Artists sacrifice a lot to pursue their gift and to ensure that their gift is shared with the masses. A picture that was taken recently at the Lincoln Park Music Festival and just ended this weekend. This is phase 2 of the music festival. And I wanted to make reference to that particular piece of artwork, the Sustainable Health, Sustainable Living Passport. And the reason that I put that on this slide is that that particular design, that artwork was created by late great Jerry Gant, one of our great artists in the city of Newark, who passed this year. He passed. And Jerry and I have had conversations leading up to what I'm here to talk about addressing the challenges that artists has and the lack of insurance, the lack of care, all of these things that he has seen himself and dealing with his colleagues in the art community and what he has dealt with himself. And we was actually talking about launching our Artists and Creative Health and Wellness Initiative. Not knowing when I spoke to him those months ago that Jerry would not be here to see this fully launched off. So I just wanted to acknowledge Jerry Gant and his contribution, and that artwork is the original art piece that he produced for our very first passport, medical health passport. Next slide, our health message, and creating an environment where it's conducive to talk about health, have fun in the conversation, and have real talk about some of the challenges that we face in our community around the issue of health and wellness. Next slide. Now, the need, and why we decided to work on artists and artist creative, keep me on my time with the artists. And I think it's important to look at need. In order for us to get the resources to do these kind of programming, you have to demonstrate that there's a need. You have to be able to articulate your ability to address that need in a creative manner, an innovative approach. So we have done that with Lincoln Park and utilizing arts and cultures as a centerpiece, as a way to bring people together and to have these tough conversations. And this is just a slide that talks about some of the impact with artists. And it just speaks to the artist and creative community is disproportionately impacted by health and wellness challenges as it relates to access to insurance. And it just gives you a few stats. It tells you that this is evidence-based. Everything that we do is evidence-based model. We have to prove and show that this is the issue and how we are in a proactive way are going to be able to address these issues and be able to, at the end, quantify an outcome that you was able to have an impact. And so that it was important to understand how the artist community is impacted. So this is a study, this is some surveys and statistics that speak to the issue with artists. And as you can see, I'm going to look at this slide, 43% did not currently have health insurance. Double the national estimate of 17% uninsured in the general population. So our artist community is really hit hard with not having access to insurance and all that happens as a result of that.
To incorporate into the Lincoln Park Music Festival the wellness component part of it, because he cares about the community. He wanted them to be able to have access to all types of resources. So he's brought up a different groups, partners, such as University Hospital, Clara Mass, among other insurance companies like Horizon, United Healthcare, Aetna, and of course WellCare as well. We've been a partner for the past few years. So with that said, I'm just going to educate you slightly on New Jersey Family Care and what it consists of and what the eligibility requirements are. So for those that don't have insurance, or maybe you thought that you were not eligible for insurance, it's good to get educated. So New Jersey Family Care is mandated by the state. It's a state federally funded program. And the way it works is it's for people, it's based on their income. So in order to qualify for New Jersey Family Care Medicaid, it's also based on income. If you're a family of one, you can earn up to $16,000. If you exceed the income guideline, a guideline that state that is mandated by the state, you won't be eligible for New Jersey family care. So it's based on your income, but it's also based on family size. So if you are a single parent, the state will look into your income based on your family size. If you have one child or several children. If it's a married couple with children, they will look at both incomes, but it's based on income. The second criteria is you have to be a legal citizen of the United States. Legal citizen or legal resident. If you are a legal resident of the country, 5 years requirement. If you're here from any part of the world and you've only been here for 4 years, you won't be eligible until your 5th year anniversary here in the state of New York. So number one is based on income, and number two is also based on the amount of years that you have been serving here in the country. The requirements can vary, but it also takes time. Sometimes when I'm out in the community, I see that people are getting impatient. They're like, oh, I applied 2 months ago, and I haven't received feedback on my Medicaid application. It takes time. It's very important that when people are applying for Medicaid, that they submit the proper requirements. You have to submit your 4 pay stubs for a month. If you get paid every week, 4 pay stubs. If it's bi-weekly, at least 2 pay stubs. But you have to submit all the legal requirements, your ID. Again, if you're just a resident, you have to submit your green card information. There's certain documentation that the state requires. If you're not submitting that documentation, that delays the process. So sometimes people get upset that they're not getting the feedback from the state as they expect. So then those are 2 of the requirements. And the third one is, of course, again, based on family size, based on your income level, how long you've been working, and every insurance company offers a different coverage, so you also need to look into that. Once you apply for a New Jersey family care for Medicaid, look into the different insurance company, because every insurance company offers different types of coverage and services. For the most part, because it's a state-mandated program, they have to offer the standard coverage. You have vision coverage, you have dental coverage, you do have a list of specialists that you can see if you have a certain diagnosis that you need care for. We also need to look at the network of providers and hospitals. Every insurance company has different coverage, every insurance company has a different network of providers, etc. So you need to look into that. Here at WellCare, we offer insurance coverage under Medicaid, and we also offer insurance under Medicare, which is Sativa, my colleague, I will introduce her shortly. She's going to cover the portion on Medicare. I do apologize that I don't go into more depth with Medicaid, because that's not my area of expertise. But if you say to me, Luz, we're willing to work with WellCare, we're willing to have you come out and host an event, or if you feel that we can offer our services, we will go anywhere, food pantries, any type of congregation, you name it, and we are there for the community. That's what we're about. So that would be me. I handle more of the marketing piece for the company. But at a later date, like my friend Keith said, we can come back. Hopefully someone else can do an in-depth presentation on Medicaid and let you know more details. But if you do have any questions, don't hesitate. Again, my name is Luz. I will be here for part of the presentation afterwards. So if you have any questions, I'll be more than happy to answer.
Before we move on, I know we've got a time restraint, so I'm going to move through this real quickly because I want to answer a few questions for you. One, Medicaid and Medicare. Medicaid is for those who are the younger population, it's under 65. Medicare is for those who are 65 and above. The difference. Also, she made reference to various companies. Under New Jersey Family Care, that's the umbrella. And all of these HMOs are contracted under New Jersey Family Care. So you actually, once you enroll, you can select a provider to be your provider for that year. And every year they have an open enrollment where if you're not happy with that provider, you can switch to another provider. Correct me if I'm wrong.
And that you can actually switch at any time. But Medicaid is a little bit different. So for example, if you're not happy because of, again, certain provider HMO doesn't have the specialist that you're looking for, or maybe it could be the provider, you can always switch at any time of the year. Medicare is a different story. Medicare, there's certain restrictions and guidelines Tika Williams will cover that, but yes, you're right. And Medicaid is from birth up to the age of 64. But after the age of 65, also the seniors are eligible for Medicaid, and I will let Tika cover that.
You hear the term Medicare, you think senior citizens, but it's also for people that have SSD, Social Security Disability. Many people have SSI, but if you have SSD, and there are probably people in the room that have SSD and do not know that they're eligible for Medicaid and Medicare. Those people that are eligible for Medicare are able to access preventive care, prescription drug coverage, wellness benefits such as your mammogram, MRIs, diabetic screening, cancer screening, and also certain perks such as transportation, and also so many things like fitness memberships, all included drug testing, drug therapy, rehab, mental health benefits, stress benefits. They're included in Medicare Advantage plans. I'm not going to go into detail. What I'm going to explain is that if you have Medicare, you may be eligible for plans that have 0 monthly premium and sometimes 0 copays, full coverage. What I'm going to do is leave my contact information on the table. My cell phone number is on the flyer and my business card. You're able to text me. If you see me on the streets, I'm from downtown Newark and I live downtown Newark. You see me on the streets, we can talk. Just stop. Hi, I saw you at the Mixtape Conference. We can talk in confidence. Everything is 100% confidential. So I'm not going to take too much time. I just wanted to let you know you may be eligible for Medicaid right now. If not you, maybe a family member. Because if you're focused on your craft and your loved one is ill, you're not able to concentrate. So at least if a person has access to health care, that's the most important thing, awareness and access to health care. So I will leave my information on the table for you. Okay, if you have any questions, contact me directly. Satida Williams from Welfare Insurance. Thank you.